Bismillah ar-Rahman ar-Rahim. Our lecture today about chickenpox or shingles, varicella, herpes zoster. Notification is not required. School exclusion differs according to the case or contact status. Cases should be excluded until full recovery or for at least 5 days after the first eruption appears. Some remaining scars are not a reason for continued exclusion. Any child with an immune deficiency or receiving chemotherapy should be excluded for their own protection, otherwise contacts are not excluded. So, by definition, varicella zoster or herpes zoster or chickenpox or shingles notification يعني الإخبار الفوري it is not required. The school exclusion يعتمد على الcase and the contact status. Cases should be excluded until full recovery or for at least 5 days after the first eruption appears. يعني الحالات اللي هي مثبتة إنه هي confirmed cases of chickenpox should be excluded إلى أن يصير عندهم full recovery أو لازم ينعزلون لمدة 5 أيام ورا ال appearance of first eruption appears. Some remaining scabs are not a reason for continued exclusion. إذا موجودة بعد الطفح الجلدي هذا not a reason for continued exclusion. يعني ما يعطينا الحقية إنه نخلي هذول المرضى ينعزلون. Any child with immune deficiency إذا كان عنده immune deficiency أو ياخذ immune therapy should be excluded for their own protection. يجب أن يتم عزلهم هذول الأطفال لأنه لحماية يعني حتى نحميهم من الإصابة بالفيرال انفكشن اللي هو التشيكن بوكس. Varicella is an acute infectious disease caused by varicella zoster virus. Varicella zoster virus is a DNA virus and is a member of herpes virus group. Primary varicella zoster virus infection lead to varicella اللي هو chickenpox. Varicella zoster virus has the capacity to persist in the body after the primary or first infection as a latent infection, and this the virus persists in sensory nerve ganglia. Reactivation of late infection will result in herpes zoster shingles. Short survival in environment and average incubation period from 14 to 16 days after exposure to rash, range from 10 to 21 days. Period of communicability, it is usually communicable for 1 to 2 days, up to 5 days before the onset of the rash, continuing until all the lesions are crusted. Communicability may be prolonged in patients with altered immunity, and those with zoster are considered infectious for a week after the lesion appears when they are moist. Varicella pathogenesis, respiratory transmission of the virus, replication in nasopharynx and regional lymph node, primary viremia 4 to 6 days after infection, and multiple tissue including sensory ganglia infected during viremia. Varicella clinical feature, adult may have 1 to 2 days of fever and malaise prior to the rash onset. But in children, the rash is often the first sign of the disease. Respiratory and gastrointestinal symptoms are absent. Children with lymphoma and leukemia may develop a severe progressive form of varicella characterized by high fever, extensive vesicular eruption, and high complication rates. Children infected with HIV also may have severe prolonged illness. Recovery from primary varicella infection usually results in lifetime immunity. A second occurrence of chickenpox is not common, but it can happen particularly in immune-compromised patients. يعني الانفكشن with chickenpox ما يعطينا lifelong immunity دائما. A second occurrence of chickenpox ممكن أنه تحدث هي صح not common لكن ممكن إنه تحدث especially in those with immune compression. Herpes zoster shingles reactivation of varicella zoster virus associated with aging, immune suppression, intrauterine exposure to varicella zoster virus, varicella at younger age than 18 months of age. Varicella complication, bacterial infection of skin lesion, pneumonia viral or bacterial, central nervous system manifestation, aseptic meningitis, encephalitis. Ray syndrome include aseptic meningitis, transverse myelitis, Guillain-Barré syndrome, thrombocytopenia, hemorrhagic varicella purpura fulminans, glomerulonephritis, myocarditis, arthritis, architis, uveitis, iritis, and hepatitis. Hospitalization 2 to 3 per 1,000 cases in children and death 1 per 60,000 cases. Groups at increased risk of complication of varicella: person older than 15 years, infant younger than 1 year, immune compromised person, and newborn of women with rash onset within 5 days before to 2 days after delivery. احنا عندنا في حالتين الروبيلا بصير عندنا congenital rubella syndrome and الفاريسيلا بيصير عندنا congenital varicella syndrome. إذا نشوف بالفيرست ترايمستر إذا حدث الانفكشن بالفيرست ترايمستر of pregnancy it confers a small risk of miscarriage. لكن إذا الmaternal infection حدث قبل 20 week من gestation, it may rarely result in fetal varicella zoster syndrome with a risk of 2% occurring at 13 إلى 20 week gestation. والclinical manifestation بالabnormalities هي growth retardation, cutaneous scarring, limb hypoplasia and cortical atrophy of the brain. إذا صار عندنا intrauterine infection هذا راح result in herpes zoster in infancy. إذا صار intrauterine infection راح يصير من هذا الطفل يولد بالانفانسي راح يصير عنده herpes zoster. هذا يحدث في 2% من الانفant. The highest risk is associated with infection in the بالثird trimester إيش راح يصير عندنا maternal varicella may precipitate the onset of premature labor. يصير عندهم ولادة مبكرة و severe maternal varicella and pneumonia at any stage of pregnancy can cause fetal death. Susceptible pregnant women who have been exposed during pregnancy should seek specialist obstetrician advice. They may be offered zoster immunoglobulin and antiviral. يعني هنا ممكن انه المرأة الحامل اذا انصابت بالثيرد ترايمستر من البريجنسي ممكن انه تاخذ استشارة طبيب النسائية وممكن انه تنصحها باخذ الزوستر immunoglobulin and antiviral drug and especially where delivery is imminent. Varicella laboratory diagnosis. How can we diagnose varicella? Isolation of varicella virus from a clinical specimen, rapid varicella virus identification using real-time PCR preferred if available, or DFA, direct fluorescent antibody. Significant rise in varicella IgG by any standard serologic assay. Varicella epidemiology. Reservoir human being, transmission person to person, respiratory tract secretion, direct contact with the lesion and temporal pattern, peak in winter and early spring. Incidence is highest between March and May and lowest between September and November. Communicability 1 إلى 2 days before until lesion have formed crusted. May be longer in immune compromised patient. Varicella vaccine composition, live attenuated virus vaccine efficacy 95%, range from 65 to 100%, duration of immunity more than 7 years, schedule 1 dose less than 13 years of age, may be administered with measles, mumps, rubella vaccine. يعني راح يصير عندنا MMR V mumps, measles, rubella, varicella. Two attenuated varicella virus vaccine licensed for use, Varivax and Frogwide. Both vaccines may be used for first and second doses of varicella vaccine. Varivax is the single antigen varicella vaccine licensed in 1995 for use among healthy persons aged equal to or more than 12 months. Frogwide or MMRV اللي هي mumps, measles, rubella, varicella is a combination of measles, mumps, rubella and varicella vaccine licensed in 2005 for use among healthy children aged 12 months up to 12 years. Chickenpox vaccine dose and chickenpox vaccine age. First dose من 12 إلى 15 months of age نقدر ويا MMR. The second dose بال4 إلى 6 سنوات of age may be given earlier, minimum gap of 3 months after the first dose. يعني ممكن أعطي الفيرست دوز ورا 3 أشهر أعطي السكند دوز، أو ممكن أعطيها بال4 إلى 6 سنوات من العمر. People not being vaccinated earlier or chickenpox vaccine for adult إذا الأشخاص اللي هم ما ملقحين سابقا بالصغر أو هم adult أريد أعطيهم الفاكسين. People 13 years of age and older should get 2 doses at least 28 days apart. يعني ممكن أعطي الجرعة الأولى بعمر 13 سنة وبعدين الجرعة الثانية وراء 4 أسابيع. Varicella vaccine recommendation. لمن أعطي الvaricella vaccine susceptible person at high risk of exposure or severe illness. منهم teachers of young children, institutional setting, military personnel, women of childbearing age and international travelers. دول الأشخاص المجاميع اللي ممكن أعطيهم الvaricella vaccine. لمن teachers of young children مثلا بالحضانات بالمدارس الابتدائية ممكن أنه أعطي للمدرسين والمعلمين. institutional setting بالانستيتيوت المعاهد والرعاية كبار السن، رعاية الأطفال، military personnel, women with childbearing age and international traveler. Susceptible person likely to expose a person at high risk for severe illness, healthcare workers, family members of immune compromised person. Varicella vaccine post exposure prophylaxis يعني أنا اليوم تعرضت إنه أكو كيس مال varicella وأنا كنت ملامسة لهم. Varicella vaccine is recommended for use in susceptible person after exposure to varicella, 70 up to 100% effective if given within 72 hours of exposure. Not effective if more than 5 days but will produce immunity if not infected. يعني إذا أعطيته خلال 72 ساعة 3 أيام ممكن إنه يصير إفكتيف من 70 إلى 100%. إذا كان عندي شخص مصاب بالفارسيلا وتعرضت للإصابة آخذ خلال 3 أيام آخذ لقاح الفارسيلا راح يكون إفكتيف من 70 إلى 100%. not effective إذا أبرت أكثر من 5 أيام لكن it will produce immunity if not infected. إذا الشخص ما معرض يعني ما مصاب هذا راح يسوي immunity. Varicella vaccine adverse reaction ممكن إنه يصير injection site complaint 20% rash من 3 إلى 4% may be maculopapular rather than vesicular average 5 lesion و systemic reaction is Vaccination is contraindicated in immune-suppressed people and pregnant women. Immune-suppressed people and newborns should be protected from exposure. If the exposure has occurred in this person, varicella zoster immunoglobulin is effective in modifying or preventing the disease if given within 96 hours of exposure. يعني دول الاميون compromised والبريجننت women منعطيهم contraindicated انه ياخذون هذا الفاكسين، لكن اذا صار عندهم تعرض للإصابة، يعني كانوا ملامسين لكيس، إذا الإكسبوجر has been occurred in this person راح نعطي الفاريسيلا زوستر immunoglobulin، راح يكون effective in modifying and or preventing the disease إذا given خلال 96 ساعة من الإكسبوجر من التعرض للإصابة. Thank you.